And just on the treatment side, like something that we're seeing as a growing trend clearly is an interest towards like the off-patent, low-cost therapeutics in cancer, specifically Ivermectin and Fenbendazole. I'm curious if NIH and NCI are going to establish some rigorous studies around it so we can understand like the legitimacy behind these claims.
It probably functions in an understandable way, probably operating on a part of the cell called the microtubules, and we have other drugs that work that way. So it has one of the things we like to see in moving a drug forward, which is something of a plausible biological hypothesis, and it's being studied. It probably, just to be clear, we should frame our expectations a little. This is not, if it has any effect at all, it's not going to be a standalone drug that people take and cure their cancer. That doesn't mean it's not a useful therapeutic. It's being studied in combination with other things to see if it makes them work better. And that's completely legitimate because it's a well-tolerated drug, and if it makes other things work better, why not? With regard to ivermectin, both of these are anti-helminth, sort of like anti-worm, anti-parasitic type drugs. This operates. It actually won a Nobel Prize for its effect as an anti-helminth, and it works on invertebrates. We're all vertebrates, we all have spines. It works on invertebrates by inhibiting a particular type of chloride channel that we don't have. So you get a great therapeutic index. You know that it's going to operate on the invertebrate, but it's not going to operate on us, and that's why it works. And that's why it's a good drug for that.
They happen because the people don't trust medicine anymore. I think there was a JAMA study a couple years ago that only 40% of patients trust their own doctors, something on that order. It's absolutely shocking that this level of disconnect between the healthcare system and patients has come about. Because traditionally, the set of people that people trusted the most was their own doctor. What you're hearing at the NIH now is an openness to ideas, even ideas that scientists would say, oh, that there's no way it could work, but nevertheless applying rigorous scientific methods to those ideas. You have to take ideas seriously, even ideas that we don't, I as a scientist would find but unlikely. But if lots of people believe it and it's moving public health, we as an NIH have an obligation, again, to treat it seriously. And sometimes you learn things that you would never expect to learn.
I think explaining the methods we use to prioritize some drugs over others. I can assure you, at the NCI at least, we aren't motivated by preserving profit for big corporations, which you hear that said, or we are motivated by one thing, and that is to reduce the burden of cancer in America.